The role of nurses in the management of GvHD is vast. From the original diagnosis, either acute or chronic graft-versus-host-disease, nurses are really quite focal and central to how we care for our patients. So from that initial assessment, whoever is doing that, whether that's the nurse or whether it's a medic or somebody else within that healthcare environment, the patient is that focus. So we've got to look after that patient. So once we've assessed them and we've worked out a management plan, the nurse becomes really central to helping deliver the care that that patient is needing. If they're an inpatient and they've got acute graft-versus-host-disease, the problems with skin complications, with GI upset, so nausea, vomiting, diarrhea, liver dysfunction, the nurse is really key to looking after that patient whilst they're acutely unwell in that hospital environment. Once that patient transitions into an outpatient department, and whether they still have some acute symptoms or are actually now developing chronic graft-versus-host-disease, the key again is the nurse at the centre of that, with frequent contacts in your day units where you're seeing patients regularly and you're caring for that patient with these long-term complications. So making sure that you're looking after their skin care, that they're not running into repeated infections, you're talking to them about diet and nutrition, you're helping them to get back into a life that's got some exercise in it, some activities, getting them mobile, moving around, helping them to be integrated back into society. Because the point of transplant is not just to cure their disease, great, you put somebody into remission, but what you're wanting to do is integrate them back into society and the jobs that they used to do, the parent they were, the child they were, get them back into school, university, the jobs that they used to do. Maybe it's a different career path somebody's going to go and do post their transplant. But you want them to be active within the society again. It's not just enough to say, oh great, we got rid of your leukemia, off you go. It's, well, we've got rid of your leukemia, you had some graft-versus-host disease, we're helping you to overcome all of that, and we want you now to be a successful person back in society and contributing again as you used to before all of this happened to you. So nurses are integral to that, and part of that massive plan from a multidisciplinary team of everybody coming together and caring for our patient, either as an inpatient or as an outpatient. So I think nursing is absolutely vital to that.